Greetings. I'll be using some slides. This is Grad College's program in financial literacy, and we're going to focus on health insurance today. Let me start these slides as we go along. So we're going to talk about, I think I am sharing, and my name is Chris Papesh. I work in the UNLV School of Public Health. I'm a visiting lecturer and I'm the undergraduate coordinator. This fall, I'm teaching one graduate level class, ACA 720, Management of Health Information System. And I teach the undergraduate class in health insurance and managed care, which is ACA 403. So health insurance managed care, why should we have a health insurance? There's many reasons why, and we're going to just a blog site soon. How does it work? Basically, you get health insurance through your employer, and usually there's a amount that the employee pays as well. If they have a family, they pay more. If a wife and children or a spouse and children, they will pay more for that health insurance. And there's a whole bunch of complex areas, premiums, deductible, co-insurance. So we'll go through some of them, some of the key issues as you look at health insurance. Why is it important? It's because it's the risk. If you have a serious accident, this is from healthcare.gov, the government website, points out that even a broken leg, it might cost $7,000 out of pocket if you don't have healthcare insurance. So it's important to have a health insurance when you're investing in a home and other areas or a business. So that's the main reason why. And you can get it through the employer, you can go online if you're an independent business person through what's called, people use the term ACA or Obamacare exchanges in Nevada and get insurance. And certain other people qualify if their employer does not offer it. For those over 65, there's a Medicare program that's health insurance that students and everyone pays into the program, and then when they're over 65, it covers a few other chronic disease areas. So here is the Affordable Care Act, often called Obamacare. It was passed in 2010. It actually has sweeping controls over health insurance throughout the United States. In addition, because Nevada opted into the Medicaid coverage, so many low-income employees can get subsidies to cover their health insurance costs. Some of the learning objectives, we're going to talk about health benefits coverage, differences in risk bearing, and talk about managed care, different types of insurance forms. By the way, under the ACA, covers defined benefits, such as a day in the hospital and different areas like that. There are some other plans called defined contribution, but they're not pre-tax, so you have to pay taxes on these programs. Here's the kind of coverage that the ACA covers. It's in all health plans in the United States. Ambulatory care, emergency, hospitalization, pediatric services, prescription drugs, preventive care. So it covers quite a wide package of health benefits. If you're in your employer's insurance, you have the independent plan or Medicare or Medicaid. There's this idea of cost sharing. So often you have to pay, such as a co-payment, which is say $30 each time. So each plan is different, or maybe your plan, it may be $50, the plan that you have. There's co-insurance where you pay 20% of the cost, whatever the operation. So you're in the hospital, it costs $50,000. You have to pay 20%, $10,000 of the cost. And there's a deductible. Often it's an annual deductible. It could be $1,000. It could be $2,000 or more. That you have to pay that first before the insurance kicks in. There's several types of cost sharing are possible. By the way, if you buy on the Obamacare exchanges, the independent plans, you're buying as an individual or a family and paying for the insurance, and hopefully you're getting the subsidies. There's several different kinds of plans. So the cost sharing, if it's platinum plan, is limited to 10%, gold 20%. You see bronze 40%. So if you want more information, you can go out to these URLs to discuss the plan. And it's called CMS, the Centers for Medicare and Medicaid, is the federal government Health and Human Services Department. A former client of mine, I put in a data warehouse for them. They have all the rules here. If you want to look at frequently asked questions, you can go out to that site or Google CMS and look out the Affordable Care Act FAQs. And there's different kinds of risk and coverage. And I'll just point out that the employer may pay for retiree health benefits and employment-based coverage. Now, the employer isn't really paying, it's coming out of your wages, so they consider it a wage cost. But essentially, the employee is paying both portions, the employee and the employer portion. There's a different types of plans, and we'll just go through these very quickly. It is complex. On the extreme end, there's a closed-in panel like an HMO, Health Maintenance Organization. We'll start with the preferred provider organization, which is the most popular now. And basically, the health insurer, such as Anthem in the state or United Healthcare, would go out and by contract sign up a bunch of medical doctors and hospitals. If you're in plan, this is just an example, it could be 80-20 in network, 60-40 outside of network. So if it's in network, you only pay 20% of the cost. But if you go outside the network to a doctor who's not in the plan, you pay much more. So you pay 40% and the health insurance company only pays 60. These are very popular plans right now. Another one is an exclusive provider organization, like a PPO, but no benefits. So you get zero benefits if you go outside the network. So it's used by large employers. Bigger employers may offer a package of different plans that the employee gets to choose. So, you got to shop wisely. You got to look, if you have a spouse, you need to discuss that, whether they have their own, she or he has their own insurance. So you got to work out all those details, or if you have a family. Here's one has been popular in the past, a health maintenance organization, such as Kaiser Permanente, which I've worked for them, putting in large computer systems. They're a HMO insurance company. They own 37 hospitals. They own a group of clinics, doctor practices in 8 or 10 states right now. They're very large in California. So the HMO, they sign up a group of doctors who only work for them in a strict closed HMO. But then there's others, which are like a PPO, where the doctors may work for them in other programs. So it depends what type of HMO that you choose, if your employer offers an HMO plan. So, and then there's a point of service, which your full HMO if you're within the plan, and cost sharing if you go outside the network. So this is some states have laws around it that the POS type structure is required in an HMO in some states. So again, you've got to look at your deductibles, what the cost is for your family, and figure it all out. And often that's once a year the employee will choose what plan to take. You really got to look at the 3-4 plans and what's the size of your family and what fits your family best. There's a difference between the point of service plan and a PPO. And here's some differences between them. Some are licensed as an HMO and licensed as an insurer and so on. So there are differences between these plans. Now, if you have questions, just shoot me an email. My name again is Chris Papesh. And here's my email address, Chris Papesh@unlv.edu. So if you have questions, I do teach this. I am teaching in person this semester. It actually is an exciting area. We use 5 Harvard case studies. And to really manage it, or if you're a business manager, you need to really understand. If you're a healthcare management, you need to understand it from the viewpoint of the health insurance company, the employer, the employee, the government, which has a major role, and it can be state and federal government have major roles in health insurance. Again, any questions, shoot me a note. Thank you, and that's all for today.